Thanks, Zoe. I really appreciate the opportunity to get to spend the morning with all of you. And it's great to see so many familiar faces and names on the call. As Zoe mentioned, I'm Doug Huntsinger. I am the Executive Director for Drug Prevention, Treatment, and Enforcement, and Chairman of the Indiana Commission to Combat Drug Abuse. And in my role, I oversee the state's response to the drug epidemic, working with all of our state agencies who are receiving federal funding or putting forward programming to help all of our local communities across the state combat the drug epidemic. So a brief background, I joined Governor Holcomb's office in 2017 with then drug czar Jim McClellan, and was his deputy until I took the appointment in 2020. And prior to that, I spent 8 years working with Governor Mitch Daniels in his administration, starting at the front desk and ending as a policy director for 13 state agencies. So I like to say that my marketable skill is trying to get government to do something a little faster and a little more efficient and being a little more responsive. So that's really me.
We appreciate that in having that skill. So thank you for that. So tell us a little bit about what currently is going on with your areas of focus and some updates that you would like to share.
Yeah, so I'm sure most everyone is aware that the CDC recently released their numbers for 2020, and we saw 107,000 Americans that had lost their life due to a drug overdose in 2020. And there were 2,700 Hoosiers that make up that number. In Indiana, that was 11.5% higher than the national average. And I believe that a lot of that is due to the fact that we're doing a better job in counting. In 2017, when we started, we really didn't have a good system for identifying drug overdoses. It was really left to the discretion of our coroners. There was a different criteria that was applied for when toxicology was performed upon a death. And so the Department of Health really stepped in, standardized all of that. And we are funding through grant funds and through state funds, we are funding all of the toxicology in the state. So anytime a coroner suspects a drug overdose, they're having that toxicology run. And so I believe that our numbers are being counted better. And my hope is that SAMHSA will adjust the metrics at which they provide us with that federal funding eventually. And we'll see more funding as a result of our better counting. But, 85 to 90% of those deaths were due to fentanyl. And whether that was fentanyl as the only substance, but mostly fentanyl as a mixture of other substances in the individual. And as long as synthetic opioids are present in our state, we plan to continue to double down on our harm reduction efforts. So starting with naloxone, since May of 2020, we have distributed over 135,000 doses of naloxone through our partnership with Overdose Lifeline. I just on Friday had the chance to meet with Fayette County, and their harm reduction team has put out about 1,200 doses of naloxone into their community, and they're able to document that at least 600 of those have been used. We also know from a nalox box, we're putting 430 nalox boxes across our state. We know that one of those nalox boxes saved 4 individuals' lives in Clark County just this past weekend. So we know that naloxone is making a difference, and we're going to continue to flood the market to ensure that anyone who needs naloxone can access it. So if any of your centers need additional naloxone, we have that available through our partnership with Overdose Lifeline, but also we have first responder grants through the Department of Health and local health department grants as well, where through the Department of Health, where they can access that stream, all of it free of charge. So please, we're going to continue to invest in naloxone. We've already spent over $4 million. We'll continue because we know that's the one way in the short term that we can save lives. We also have fentanyl test strips available through our partnership with Overdose Lifeline. So if you have individuals who need those, we're happy to provide those as well. We also launched 10 street outreach team, harm reduction street outreach teams across the state this past winter, and we actually just convened all of them and some of our other harm reduction providers across the state on Friday to really skill everyone up. We know that all of our providers are at different have different capabilities, different skill sets, and so really wanting to make sure that everybody is aware of best practices and is working to ultimately to reduce harm in their population, but also to ensure that we are helping individuals access treatment when available. So we've also provided some community coordination grants to a number of 21 communities across the state. This is about $100,000 to help with the coordination in their communities, and especially around our criminal justice system. We've worked with our local JRACs to ensure that, and our community corrections and probation, to ensure that we're really providing those necessary supports in those areas, that meaningful connection to treatment, and then also funding our jail programs. We've invested over $6 million, and there will be more to come in this space with our county jails. And so that's another area where we're continuing to invest in treatment, with the idea that we're connecting individuals while they're in the county jail to a treatment provider that's on the outside who can connect with them and provide that follow-up, and frankly, oftentimes provide that treatment that an individual needs as they're exiting. As all of you know, our recovery hubs, we have 21 statewide now. That was a huge effort and undertaking during the COVID to ensure that those were stood up as a way for individuals to connect. And then finally, we have our recovery cafes. Just a year ago, Indiana had 2 recovery cafes, and we now have over a dozen of those across the state. It's a low barrier access point for individuals who are seeking recovery or in recovery, to build that community, but also as a front door for individuals who may be kind of ready just to dip their toe in the water, not ready yet to fully commit. So another great way for individuals in communities all across our state, all different size communities, to really engage that population.
Wow, Doug, that's pretty incredible stuff. I know a lot of us are involved in various levels of these initiatives. How if you're not connected? How if my member is not connected to some of these initiatives? How best to learn more and find out how to plug in?
Yeah, so one, you can always reach out to our office. Our email address is drug PTE, that stands for Prevention, Treatment, and Enforcement. So drug PTE at gov.in.gov. Or you can find us through our website at recovery.in.gov. But I'm sure many of you know Becky Puner at the Division of Mental Health and Addiction. She is my partner in all of this, overseeing all of the federal funds that we receive from SAMHSA, or Brian Bushing at the Department of Health, who's overseeing a lot of the CDC funds that are coming in. So we all work very closely together. We try to make sure that our efforts are coordinated and that our funding streams aren't overlapping. It's not always that simple, but we try to make sure that we are working together. And another great opportunity that's coming forward is the opioid settlement funds. Those are, and we're really trying to take a holistic approach as we have begun to look at what are the opportunities that we can fund with this money. We're looking at all of our funding streams. And so there are things that we've said, wouldn't this be great to do? But we realize that it actually makes more sense for us to use our state opioid response grant funds, or it makes sense to use CDC funds instead of putting it toward our opioid settlement. If you recall, this is $506 million that we're going to receive over the next 18 years. And a portion of this settlement is front loaded, so we will receive more in the first probably 6 or 7 years than we will receive in the tail ends. But this will really allow us to really provide some sustainability to some of our programs, especially when you talk about prevention in our state. That 2-year funding cycle really doesn't allow us to truly dig in and invest in our prevention efforts. And my hope is that not just the state, but all of our local communities will invest in prevention through these funds. So that $507 million that we're going to receive is split 50-50 between our local units of government and the state. Our local units of government, there's an intensity metric that uses overdoses, overdose deaths, and morphine milligram equivalents that have been shipped into a community. And so that really, it then determines how much a community gets. And then there's a lot of other caveats. If a community receives less than $1,000 over that 18-year payout, that money rolls up to the county. If there is a 15% of a portion of those funds that is unrestricted, there is, so that leaves 35% of most of the funds. And again, these are multiple different settlements that we talk about as a whole. And so there are different rules to the different funding streams, which complicates this just a tiny bit. But we're working to try to make this as easy as possible for our local units of government. I encourage all of you to reach out and engage in those conversations, ensure that they are planning to use them in evidence-based ways. You can't use these funds for capital, so that immediately precludes things like mental health wings in a jail, morgues, all kinds of different ideas that I've been asked about. Our goal is really that this money be invested in our communities in ways that are truly going to support those with substance use disorder. And for the state funds, we're looking at how we can have an incentive program. So how can we have match dollars? How can we put out some opportunities where our providers can partner with their local units of government, receive match funding or receive funding to invest towards a match from the state that will be able to then, double or triple the funding that everyone's receiving. So we are working on a website. Again, that will be at recovery.in.gov, hopefully later this week, if not beginning of next week. And we look forward to how also to hearing your ideas on ways that we can support not just all of our providers, but our community mental health centers through this funding as well.
Wonderful. And I know I did receive quite an extensive piece at JRAC that really breaks down all of the criteria of those funds that I'll be sharing with the CEOs. It's pretty extensive. I think the website will kind of make that a little bit more clearer for folks, but I will be sharing that with all of you. And then who local government wise, Doug, should people reach out to regarding that to make sure that they're at the table?
Yeah, well, first, that 11-page document is actually fairly broad, and it does encompass a lot of activities. So that is very helpful. But that also, when we talk about groups that maybe aren't providing the best quality of care or providing evidence-based or even evidence-ish practices, that does leave the door open or cracked a little bit for some of those individuals to access this fund. So we want to make sure that we as the provider community, as the state, are really doing everything we can to support the locals, because many of the people I'm getting ready to list off, this isn't a space in which they have really engaged, and it's not really their lane. So that would be anyone from your county commissioners and county councils. Obviously, the commissioners will put forth the plan for how the funding will be spent, and the council then approves that plan. Same with the mayors and city councils, and also there are some towns. So you have some town managers or city clerks that will be receiving funds. And obviously we get to this level, that's where we're really going to need to see people begin to think more regionally, think more about how they can partner their funds. And I'm really talking about, $1,500, $2,000 that they're receiving a year for this. How we can help them roll it into something that's quite larger, because we know in many communities across the state, it is not the small town that necessarily is providing that treatment or providing the harm reduction. that is coming from either the county seat or more of a regional effort in some of our communities. So we really need to be thinking about how we can use these dollars for the greatest impact. In some of our communities, the only option they'll have is to provide naloxone, which isn't a bad thing, but we're already funding naloxone, so we could use some of these dollars for a greater impact with our providers.
Well, right. And I see our CMHC system fitting into that just perfectly with our regional reach and our rural reach. And so, really being that resource, especially because we do evidence-based practices in that. So I just, if you have not reached out to those areas of local government to be at the table or your local JRAC, I strongly encourage you to do that, because a lot of great work is being done within those local JRACs. There was also an invitation sent to those community leaders regarding the JRAC Summit that's happening on October 21st. And so that's a nomination process. And so if you are a member of your center has not been nominated to be able to attend that, my vision is to have all 24 community mental health centers at the JRAC Summit. So please reach out regarding that too, because I think more will be done around that opioid settlement money, and some conversations will be had. Doug, would you agree on that?
Yeah, I think what will really be helpful is maybe not conversations specifically about the opioid funding, but really how we can invest in our criminal justice system through the sequential intercept model. The Chief Justice and the Indiana Supreme Court and Justice Goff have been so supportive of not just our work, but the integration of the justice system into this, understanding that we right now, without a fully functioning crisis system in our state, individuals are ending up in the justice system as a default. So this is really looking at how we can really begin to, again, use 988 as that base for someone to call. And when we can't resolve the issue over the phone, it's that who responds. And having our teams that we can deploy to deal with the crisis. And then when they can't resolve those in the field, having somewhere for someone to go. And again, each of that I think becomes more regional as you look at each of those three spaces. But I'm just really excited about this conference. It's the Chief Justice did one on addiction before COVID, really trying to educate the bench about substance use disorder and making sure that they weren't prescribing from the bench. And this is really, I'm going to double down on the sequential intercept model, looking at those 0 and 1 intercepts. How can we deflect people from the justice system as a whole? And so I'm really excited I know many of the communities have built out the drug court model and some of the reentry pieces, but I'm really looking forward at how we can begin to even divert people from the system before, at the very beginning. So this is really exciting work that they're doing, that's happening through the state JRAC. And one thing I want to mention as a way to really frame the conversation with these stakeholders, at the state level, we're using the Johns Hopkins Bloomberg School of Public Health's their 5 principles for using the money. And so when you have these conversations, it's spend money to save lives. 2 is use evidence to guide spending. 3 is invest in youth prevention. 4 is focus on racial equity. And 5 is develop a fair and transparent process for where to spend the funds. And so I think all of those really provides a really great runway to have that conversation with individuals who perhaps haven't quite had experience in this arena and may not know exactly where to go. And their first thought, I think, at the county level is how can they help their sheriffs and how can they help with that mental health crisis piece. But they're not thinking about it through the provider lens or through how do we build out a robust crisis system. They're thinking, how can we provide resources in the jail? And so I really want us to focus on how can we stop people from going to the jail first. So that's the exciting part there.
think a lot of us will agree with you on that one too. So I think we could be very helpful on that. And so a couple questions that I've received, is there a breakdown by municipality as far as those funds? I know there's something out there, but has that been defined or shared yet?
No, so we don't have the final amounts yet. We actually just met with the Attorney General's office yesterday, and they're still waiting on the final amounts. They have some estimates, but again, they're essentially taking a whole number and dividing it across 18 years. One of the settlements pays out over 11 payments, which 11 years. The other one is over 18, and then they are all paid out at different percentages over the course of those time periods. So there's a lot of math that goes into it. They're waiting for those final numbers so they can, begin to really plug those into their formula. We don't want to publish anything that's estimates because we don't want anybody saying, well, you said I was going to get, which we know will happen. So exactly, but I would expect those soon. They are hoping to have a meeting with the settlement administrator within the next few weeks. And we've already been working with them on how we can provide something. I don't know if anybody's looked at the North Carolina settlement page, but they have a really great breakdown that shows exactly how much each local community is going to receive over the each year of the settlement. And theirs are all estimates, but that's how they decided to do it. So as soon as the Attorney General's office has those, I believe they'll be either posting them to their page or we'll be putting them on ours.
Awesome. And I will make sure to keep an eye out and include that in my updates so that members can, sometimes you might receive things a couple times, but sometimes if you don't, then it might get missed. So I'll make sure to include that.
And we'll make sure we send you, once the website goes live, we'll make sure we send it to you. And I just encourage everybody to continue to check back. We'll be updating it as we have more information.
Great. And then the other question is, can the 5 steps be sent out? And I did note those. So we are recording this, but I will highlight those 5 John Hopkins principles.
We can send those to you as well as where we're planning to invest state funds right now. Those broad categories are our treatment and recovery infrastructure, workforce, because we know that we can't expand access without expanding our workforce and growing our people. And so we're looking at a number of programs around how can we have our peer recovery coaches, how can we turn them into OBHPs, and how can we skill up our OBHPs to be clinicians. So we're working on a number of things around that. That's actually something that we might transition over to our opioid response dollars, but looking at this as a whole, it is something that we are focused on prevention and not substance use disorder prevention. That's great, but I really want us to focus on trauma and adverse childhood experiences, really looking at how we can begin to prevent all sorts of social issues. And then finally, harm reduction, because as long as fentanyl is in the market, we're going to have to continue to double and triple down on the harm reduction work that we do.
Absolutely. Yeah, that would be great. If you send that to me, I'll make sure to get it to the membership so that they have that. Any other questions from those on the call for Doug as we're coming close? I feel like we could talk all day, Doug, but any other questions that you would like to ask?
Zoe, can I ask a question real quick?
Yeah.
Doug, earlier you mentioned that there would be additional funding around jail services. When do you expect that funding let, and will it come through DMHA?
So yes, it will come through DMHA. It will be in the DEB system. It is accessed through our sheriff. So you will need the sheriff to sign up through the Indiana Sheriff's Association. And the sheriff should know Steve Luce, who's been an incredible partner, but they're acting as our technical assistants for our sheriffs and really helping provide that connection between law enforcement and our provider community.
Great.
And as a timeline, we are out of funds for this fiscal year. I mean, we're not at zero, but we are not onboarding anyone else at this time. We will have more money on July 1st.
Okay, very helpful. Thank you. Any other questions? And that was from Beth Keeney, if you guys didn't recognize, at Life Springs, the CEO there. Okay, well, I just want to give a couple quick announcements in the interest of time. First, Doug, thank you so much for connecting with my membership, and really appreciate the great work that you've done. It's absolutely incredible. I remember the days where people didn't know what Narcan was, and I now carry it in my purse to be able to administer it. And so I think of how much work has gone into that, and I know you've been behind a lot of that. So really appreciate that. Council announcements, I did send up an update yesterday. So please review it because it does have some important state updates as well as federal updates. The one thing I wanted to share, since I have a captive audience, is that tomorrow is Hill Day virtually. If you have time to sign on to Hill Day, our very own DMHA leadership, Jay Chardry, will be presenting on our legislation that the Council and Mental Health America and DMHA work collaboratively on. And Doug really had a voice to that. I initially met with him around CCBHC. So if you can attend, I sent out fact sheets to be able to speak to legislators and call to actions that will be done during the day. But the first thing I want our legislators to hear is federal support for CCBHC. And the last thing I want our legislators to hear is federal support for CCBHC. So if we can all have that voice, and then I will be in DC next week meeting with the number of federal legislators to follow up on that Hill Day. And so if you do have any good conversations or connections, please reach out to me so that I can connect those dots or thread that needle. So that is taking place tomorrow. July 28th is our quarterly meeting in Lafayette, Indiana. Boiler up, my hometown, really West Lafayette. And it will be youth focused. However, our business meeting will have a number of state updates. I've already asked Medicaid to come to give an update on the telehealth changes that are happening quicker than what we can really understand and process. I've asked DMHA to come to give a CCBHC update, as well as DMHA and Medicaid to share about the updates from the MRO manual. So that is going to be a very crucial business meeting on July 29th. The evening of July 28th, we will be celebrating my friend and colleague Tom Gillum's retirement from Valley Oak. So join us. Our next Cup of Joe, so July, Zoe is on vacation. So we can't have a Cup of Joe without Zoe. So I will be taking that time with my family. And so our next one is August 2nd. And our guest speaker is Teresa from Vocational Rehab. There's been a number of programs and funds that have been going into employment services. And so I want everyone to know what those are, even if that's not your area of expertise, just how to connect those dots. So she will be there. And so now, last but not least, we have our Starbucks winner. And that is Wayne Peterson, Stephen from Bowen. So congratulations. You probably already received it, knowing Denise, and that will be emailed to you. So we are just 3 minutes past, so I want to be respectful of time. I really appreciate all of you. So let's raise our cups and Cup of Joe with Zoe fashion, and cheers to the great work that all of you do. If there's anything that you need, please do not hesitate to reach out. Doug, again, thank you so much. Appreciate you. Have a great day.
Thank you.
Thank you.